Dr. Srivastav, जब आपके patients आते हैं kidney symptoms लेके, how relevant does it become in diagnosis on what the patient has been eating? What is the diet like? Does that help you, and do you see the food habit connection with the several diagnoses that you're making?
Thank you, Megha, for inviting me. That's a good question. So dietary habits, they have a very strong association with the diseases. Although they are not the only factor.
Okay.
So say, for example, if I'm seeing a patient of kidney stone, then there are certain dietary habits which predispose a person. If a person is chronically dehydrated, if he's taking a very high salt content diet, very high sugar content diet, then he has a higher risk of developing kidney stones. We are talking about obesity now. A person who is obese, who has a BMI which is higher than the normal range, he has a higher risk of kidney stone, many other diseases, and you'll be surprised to know even cancer. So obesity becomes a risk factor for, say, for example, kidney cancer and many other cancers. So there's a strong association, and we always try to find out the dietary history from the patients. It is very relevant.
Dr. Srivastav, also there is this trend of an early onset of a lot of diseases that are, youngsters, children. There are cardiovascular ailments, diabetes in children, kidney stones, I'm sure, cancer even. I want you to talk a little bit more about the food habits of childhood and what we are feeding our children, what choices, like Atishi was saying, that it's so easily accessible, that packet of chips is so easily accessible. How is that impacting the risk of disease in the long run for the children?
Yeah, so whenever children are going for a packet of chips, we don't take it that seriously, and that becomes a habit. The food habit, it's a habit. It becomes a choice. So I will quote here a research which has come out of SGPGI Lucknow, and also there is data from AIIMS New Delhi. The mean age of diagnosing kidney cancer globally is between 65 to 75 years of age. That is the average age. But in India, we are getting these cancers at an average age of 55 years. So we are getting these cancers almost 20 years earlier as compared to the Western population. Then there's another research which was done on immigrant population in the United States. The Southeast Asians who have been living there for quite some time, the research found out that the incidence of cancer was much higher in those individuals, those Indians, as compared to the similar age group back at home in India. So what has changed? When they moved to United States, probably there is less pollution, there is less adulteration, maybe the similar kind of stress, but the food habits are the basic things which change. More processed food, more packaged food, high salt, high sugar. So probably that is contributing a lot for early onset of these diseases.
Right. So that one choice that the child is making today, or as a youngster that we are making today, is going to impact us in the long run. So we have to be very mindful. Some of us would like to eat out, once in a while and go for that pack of chips. Is it like completely no-go? What does the doctor have to say?
So once in a while is okay, but if it's a habit, then it can be a problem. So yes, it is difficult to assign what proportion of diseases are because of your food habits. So I'll give an example. See, human body is a much more complex machine than what we see around here. So the build quality, that is your genetics, it is very important. What quality of machine is given to you, that is your chromosomes or genetics. But then it also matters, say if you have a very fancy car, but this will also matter what kind of oil you are putting into it, how you are maintaining it, and what terrain you are taking it to. So if you have got your genetics, you are predisposed to certain diseases, but if your diet is bad, if your lifestyle is bad, you are going on a rough terrain every now and then the diseases are going to get precipitated earlier, maybe in a worse form, difficult to control. So, yes, dietary habits.
So
are
if
very
you're
important.
predisposed, then you have even more
Yeah.
of a responsibility to eat right and make the right choices.